Bony pelvis. The pelvis is a complex structure composed of several bones, including the two hip bones, also called the innominate bones, the sacrum, and the coccyx. These bones are joined together by strong ligaments and form a basin-like structure that supports the weight of the upper body and connects the lower limbs to the axial skeleton. The pelvis is divided into two parts: the greater pelvis, also known as the false pelvis, and the lesser pelvis, also known as the true pelvis. The greater pelvis is located above the pelvic brim, which is formed by the iliac crests of the hip bones. The greater pelvis is bounded by the abdominal wall anteriorly, the lumbar vertebrae and muscles posteriorly, and the iliac fossae laterally. This part of the pelvis does not play a direct role in childbirth. The lesser pelvis is located below the pelvic brim and contains the pelvic cavity, which is the space within the pelvis that contains the pelvic organs, including the bladder, uterus, in females, and rectum. The lesser pelvis is bounded by the pelvic inlet, formed by the pelvic brim, the pelvic floor, formed by the levator ani muscles, and the walls of the true pelvis, formed by the hip bones, sacrum, and coccyx. The hip bone consists of three parts: the ilium, ischium, and pubis. The ilium forms the superior part of the hip bone and articulates with the sacrum at the sacroiliac joint. The ischium forms the posterior and inferior part of the hip bone and supports the weight of the body when sitting. The pubis forms the anterior part of the hip bone and articulates with the opposite pubis at the pubic symphysis. The sacrum is a triangular-shaped bone located at the base of the spine and forms the posterior wall of the pelvic cavity. The coccyx is a small triangular bone located below the sacrum and forms the inferior end of the vertebral column. The pelvis also contains several important muscles, including the pelvic floor muscles, which play a crucial role in supporting the pelvic organs and maintaining continence. Other important muscles include the obturator internus, piriformis, and levator ani muscles.